In an effort to improve healthcare access in hard-to-reach areas with difficult terrains, Meghalaya Health Department is using 4x4 all-terrain ambulances. During a press briefing, health officials acknowledged that the 108 ambulance service currently operates in 45 locations, with plans underway to expand its reach to more regions. Secretary of Health and Family Welfare Ram Kumar S. noted that 5 4x4 ambulances have already been deployed, with an additional 5 on the way, and another 10 are being procured to serve remote areas.
Lives has become a big priority. And there were a lot of questions also asked on the
4x4 ambulances are not in manufacturing at all. So you have to get a 4x4 vehicle and fabricate it and do it. It's a whole different exercise we have to do. So we have firmly done that. 5 ambulances have already been given in the facilities. Another 5 have been procured separately. But there is one facility level ambulances, which means PHC, CHR, district level ambulances, number 1. Number 2 are the Chief Minister's Safe Motherhood Scheme fleet. These are vehicles which have been tied up by the decentralized way by the facility locally, so that any pregnant woman, child who has requirement of a vehicle to transport to the hospital, to a higher facility, to diagnostics, or back to dropping them home, they can utilize it. This